Hello and welcome to another Friday video where we talk about gua sha. So in today's video we're going to have a look at issues with your elbow and how to approach them with gua sha. So if you have a problem with your elbow, then you're not alone. So many people have got issues with the movement or pain or tension in the elbow area. Now sometimes these have got names, so for example tennis elbow or golfer's elbow and bursitis, and sometimes there's an inflammation of the tendon, and sometimes there's an issue with the muscle, and sometimes the problem is somewhere totally different. So what can we do with gua sha and the elbow? So let's try and understand it first of all. Let's have a look underneath the skin in terms of Chinese medicine about your elbow. One of the things that really helps is knowing where the channels go on the arm, because they're going to inform you where you want to treat. The obvious ones are going to be the ones that often are involved with the structural problem of the arm. Well, first of all, it's going to be large intestine. And so the large intestine is going to come from your index finger kind of along this line to the middle of your elbow there, often where there's a lot of pain, and then up the side of your arm. So we know that this part here, well, that's connected with the large intestine. And then the closer you are to the bone of the elbow, well, then we've got the small intestine, which is coming along from the little finger into the gap between the two bones of your elbow, and then coming up the back of your arm, and the triple burner, which is coming from your ring finger and then coming in the back of your arm, and then coming actually at the over the olecranon on the elbow. And so these ones are often the structural problems which are over this part. So the lateral side of your elbow are going to be something connected with one of these. So if I switch my arm this way, so it's kind of more open and I can feel that the triple burner is going to be more on the olecranon here. Then we've got a nice gap where the small intestine is, and then if I come across, we're coming to the inside channels, and these will be the heart ruler or pericardium, and the lung, which are on the inside. So structurally speaking, it's usually the ones which are on the outside which are going to cause the trouble. So I've been sawing too much wood in the forest, and I had bursitis. So what happened was that the end of my elbow ballooned up, and I looked a bit like Popeye, which was hilarious to everyone else apart from me. And it caused considerable pain when you touch anything. And so that's pretty obvious what was going on in terms of channels. It was getting blocked just here because, of course, I was sawing too much, and that blockage there was affecting the triple burner channel. And so the treatment was on the triple burner channel to try and resolve the bursitis, although it's pretty obvious why it was there. So it was just a local problem here, because sometimes when you have a problem in your elbow or other places, the symptom is in the elbow and actually the problem is somewhere else. But sometimes the problem is just there. And of course, each case is totally different. So here are the main zones which are on the actual elbow itself. So you can see how they're positioned. And so the large intestine channel, which is coming along here, this is where it's going to pass through, and this is large intestine 15. And then if I come behind here, so we're coming down here. Oh no, that's positioned, that's the right place there. And this is small intestine 8, triple burn, and behind that is triple burner 10. And then coming on the inside, we have the channels coming down the arm. And so the channel on this side, this will be the lung 3, and this will be the heart ruler or pericardium, and that's heart ruler 3 or pericardium 3, and then this is the heart here, and this is heart 5. So you can see the lines kind of coming down the arm. This is roughly although they're kind of coming on the inside up here. And so if we have this information of where these areas are and where these channels pass through, so when there's pain, when there's tension, and when there's difficulty of movement, then the closest area and the closest channel is going to inform us a little bit about what might be affected. So how do you treat it with gua sha? Well, that's easy, because if it's a local problem, sometimes it's not a great idea to actually scrape on a local problem, because if there's inflammation, you might make it worse. And so this is why knowing where channels are is quite useful, because you can then treat lower down than the elbow or higher than the elbow, but you're following the channel of the one you think might be affected. And each of these channels has got a particular direction. However, if you're treating a local problem, then the direction is less important, because you're not following the whole channel down. You're just focusing on one particular area. And if you're focusing on that particular area, the direction is not so important, because what you're doing is you're going into the connective tissue and trying to release that. Something that's very often missed is the fact that your elbow, in treatment terms, is very much connected with your knee. So if you have a problem with the elbow, you can actually treat it with your knee as well. And so similar joints treat each other. And so this is part of holographic gua sha. And so, for example, the large intestine channel, which is coming along here. Now, the large intestine channel is intricately connected with the stomach channel. Now, the stomach channel goes down your body and goes right through your knee and comes to the lateral side of the knee, which will roughly match the lateral side of your elbow here. So if you were to have a problem at the elbow and it was some way connected with the large intestine channel, then treating the stomach channel around the knee, not actually on the knee, but higher than the knee, lower than the knee, looking for issues in that area. And when you come across pain or tension or reactive areas, then treat those. And it's the same with, let's give you another example. How about this one here? So how about the small intestine, which is coming down the back of your arm? Now that's intricately connected with the bladder channel. Now the bladder channel is the back of your body, the back of your leg. And so if you've got a problem in this area of your elbow, have a look at the back part of your knee and your upper leg and lower leg, and look for tension and reactive areas. And then treat them with short scrapes. So you're putting pressure on, and you're not just scraping superficially, but you're actually putting pressure and circling and scraping into the connective tissue. So that's it from the forest today, and I'll be seeing you next week. So don't forget to like this video and subscribe to this channel.